Mr. Saktiandi Supat.
Mr. Speaker, sir, may I have your permission to take questions 19 to 26 together, please?
Yes, please.
And I will also address questions raised by Mr. Seah Kian Peng and Mr. Gan Thiam Poh for the sittings on the 11th and 12th of January. So, over the past 2 years, the Ministry of Transport and the Civil Aviation Authority of Singapore have worked closely with the Ministry of Health and other government agencies to reopen our borders in a careful and calibrated manner. Mr. Saktiandi Supat and Mr. Dennis Tan have asked how we reviewed our border measures in light of the Omicron variant, including what global and domestic indicators we monitor to inform our measures. Essentially, it is a composite of both domestic and external factors. And let me elaborate in the context of what we have done over the last several months. In September last year, with a substantial proportion of the Singapore population vaccinated, we launched the vaccinated travel lanes. 2 months later, on the 26th of November, the World Health Organization designated Omicron as a variant of concern. Then, scientists around the world were still trying to ascertain Omicron's transmissibility and virulence relative to Delta, and the efficacy of existing vaccines against this new variant. As a precautionary move, based on reports of the spread of Omicron in sub-Saharan Africa, we restricted the entry and transit of non-residents from Botswana, Eswatini, Lesotho, Mozambique, Namibia, South Africa, and Zimbabwe from the 28th of November, and from Ghana, Malawi, and Nigeria from the 5th of December. Residents returning from these countries were subjected to a 10-day stay-home notice at dedicated facilities. We halted the expansion of the VTL scheme and deferred the launch of the already announced VTLs to Qatar, Saudi Arabia, and the United Arab Emirates. We also decided to maintain the daily quota for VTL air travelers at 10,000 rather than increase it to 15,000 as we had earlier intended. On the 22nd of December, given the rapid and global spread of the Omicron variant, we froze the sale of new VTL flight and bus tickets for entry into Singapore from the 23rd of December to the 20th of January. We also imposed a 50% limit on the daily number of VTL travelers from the 21st of January this year. Mr. Lim Biao Chun has asked whether this freeze was necessary given our approach of living with COVID-19. As I have outlined, the freeze was part of a series of calibrated moves informed by the latest public health risk assessment, as well as developments around the world. It was essential to balance the need to manage the risk of imported Omicron cases while minimizing disruption to travelers who had already made VTL bookings to enter Singapore. Ms. Fumi Ha had asked earlier about the breakdown of imported cases for Omicron. If I can give you in summary, there were about 2,600 cases that were imported. The key sources were the US at 16%, the UK at 16%, and India at 11%. This broadly corresponds to the VTL traveler volume, and as most members would appreciate, it also is informed or influenced by the incidence of Omicron in these countries. I would add that the component or the composition of this, less than 10% were actually the short-term visitors, that is travelers. So the bulk are actually SCs, PRs, and long-term visit pass holders who are returning to Singapore from overseas. Ms. Poh Lee San, Mr. Gan Thiam Poh, and Mr. Seah Kian Peng have asked about the additional enhanced measures for VTL travelers. In the first week of December, in consultation with MOH, we introduced additional supervised self-administered antigen rapid tests for VTL travelers on the days 3 and 7 after arrival. This is on top of the pre-departure and on-arrival test requirements. VTL travelers were also required to undergo self-administered ARTs on days 2, 4, 5, and 6 of their arrival before going about their daily activities. And those who test positive are required to undergo a confirmatory PCR test. So basically, pre-departure, on arrival, and then days 2 to day 7, there's daily ARTs self-administered, but on days 3 and 7, they have to do it under supervision. And these have to be reported, and if there's a confirmation, then they go for a PCR test. Collectively, these adjustments to our border and other measures have allowed us time to study and better understand the Omicron variant, to strengthen our defenses, including our healthcare capacity, and to get more people vaccinated and boosted, as we have heard. We will continue to work closely with MOH to regularly review our border measures. As part of learning to live with the virus and its variants, we must press on with our efforts to restore our connectivity with the world while safeguarding public health. Our goal is to restore quarantine-free travel with more countries and regions as allowed for by the public health assessment. Mr. Saktiandi Supat asked about the additional measures to protect airport workers from Omicron. Since the 2nd of December, we have enhanced the personal protective equipment and testing protocols. All frontline airport workers are now placed on a 7-day PCR rostered routine testing regime. For higher risk frontline airport workers, an employer-supervised ART was introduced on the 3rd day, in addition to their 7-day PCR RRT. Further, all Singapore air crew arriving from affected regions are required to undergo an on-arrival PCR test and post-arrival PCR tests on days 3 and 7. These protocols will be adjusted as they have in the past in accordance with the latest public health risk assessments. Mr. Saktiandi and Dr. Tan Wu Ming asked about airflow and COVID-19 transmissibility at the airport. Since the onset of the pandemic, Changi Airport Group, CAG, has progressively upgraded the air ventilation system at the airport. For instance, CAG has upgraded the filters in the air conditioning and mechanical ventilation system to MERV 14 filters, which are able to remove about 85% of particles of 0.3 to 1 micron in size. In other words, they can filter out particles smaller than the size of a respiratory particle containing the COVID-19 virus. With the emergence of the more transmissible Delta variant in May last year, CAS, CAG, MOH, National Environment Agency, and the Building Construction Authority conducted an airflow study to identify spaces at the airport where ventilation and filtration could be further stepped up. Since then, 350 high-efficient particulate absorbing, or HEPA, portable air purifiers have been installed throughout the airport terminals at locations such as the staff canteens, rest areas, and health screening stations. These HEPA air purifiers are also used in hospitals, and they help to reduce the risk of airborne transmission of COVID-19. Since September last year, CAG has also installed ultraviolet C sanitation equipment in the airport terminal air conditioning systems to provide an additional layer of defense. Mr. Dennis Tan, Mr. Leon Pereira, Mr. Saktiandi Supat, and Mr. Sean Huang have asked about upcoming VTL moves and the outlook for our air and maritime hubs in 2022. Our maritime hub has weathered the COVID crisis relatively well, with container throughput at our port likely to reach an all-time high in 2021. Maritime businesses also continue to establish and expand operations here. We expect the favorable outlook for trade and shipping to continue in 2022. According to industry projections, global seaborne trade is expected to grow 3.5% in 2022, slightly below the estimate of 3.6% last year. We are working with our tripartite partners to seize these opportunities, continue growing our maritime sector, and create more good jobs for Singaporeans. On the other hand, air travel is expected to take several years to recover to pre-pandemic levels. Notwithstanding this, we remain confident of the long-term potential of air travel and are resolutely committed to working with Changi Airport Group and airline partners to rebuild and reclaim Singapore's status as an international air hub. Compared to 3% at the start of 2021, passenger traffic at Changi increased to about 15% of pre-COVID levels by the end of December 2021, largely aided by our VTL schemes. A study by IATA and Oxford Economics has projected international passenger volume at the end of 2022 to recover to about 55% of 2019 levels, which is up from about 20% at the end of last year. Therefore, barring unexpected setbacks like Omicron, we anticipate further recovery in 2022. To Mr. Leon Pereira's query, we do not restrict any airline from applying to operate VTL flights. The overall quota of inbound VTL travelers is allocated to airlines based on the plans they submit to CAAS. Low-cost carriers such as Scoot, AirAsia, and Jetstar Asia already operate VTL flights from Malaysia. Scoot also operates VTL flights from Thailand and the Republic of Korea, Australia, and Germany. Mr. Pereira also asked if we would allow more VTL flights during festive periods. We've heard from the MTF and also in today's session in Parliament. We closely monitor the demand for VTL flights, and we will regularly review the VTL quotas, always taking into consideration the prevailing public health assessment. Mr. Sean Huang asked about our plans for the Singapore Air Show in 2022. The Singapore Air Show is one of the world's leading air shows and that brings together aerospace and defense leaders and key decision makers to conduct business and forge partnerships. The event organizer, Xperia Events Private Limited, has announced that Singapore Air Show 2022 will go ahead from the 15th to the 18th of February for trade visitors only. To ensure the success of Singapore Air Show 2022, our government agencies are working closely with the organizer on the public health protocols to facilitate its safe and smooth execution, including ensuring the safe entry of international trade attendees and safe management measures at the event. As part of living with COVID-19, we must shift to a new setting that will enable us to stay connected to the world. It is essential that we press on with our mission to reopen our borders. The VTL scheme is a useful pathfinder for us to establish, test, and build confidence in safe reopening to vaccinated travelers. Ultimately, we want to work towards quarantine-free travel for all vaccinated travelers. Singapore's global connectivity is critical to our economic competitiveness and the livelihoods of our people. It underpins our status as an international business center and a global trading hub. Over the past 2 years, the government has provided significant support to preserve core capabilities in this strategic sector and to help them tide over this crisis. We will continue to work closely with our aviation stakeholders to rebuild a safe and sustainable Changi aviation hub.
Mrs. Saktiandi.
Mr. Speaker, I'd like to thank the Minister for his comprehensive answers. I have two supplementary questions. First, in relation to Nikkei article on the 4th of December, I quote Indonesia's Deputy State Enterprise Minister, Mr. Kartika Mojo, mentioning in Parliament that he added that Kuala Namu airport, which they are actually looking into working to operate Indonesia's North Sumatra region, He says Kuala Namu can be a base to reduce dominance of Changi and KLIA, and said that GMR Airports has committed 56 trillion rupiah or 3.8 billion to support expansion. My first SQ is in relation to that, and Minister, you mentioned and elaborated about the aviation hub outlook. Can Minister share what are the risks of our regional partners trying to gain a foothold into our aviation hub status in terms of growth of our aviation growth and hub status as well? That's the first question. Second question, I'm heartened to hear that CAS is working to improve the airport ventilation rates, especially in a built environment. But the airport face is key, and I hope we can continue to enhance the airport face cleanliness and the filters and airflows. My question is in relation to transport passenger volume. If we're going to grow it further forward, what measures can we further do to enhance it even further? Because definitely with Changi Airport, we want to enhance transit passenger volume even further as well. Thank you, Speaker.
Mr. Speaker, I thank the member for his questions. First, on the reports that he cited, I don't think I can speak with authority on the specific plans that the Indonesian government, or for that matter, any other government or regional players have. But I think let me start by saying that Changi is no stranger to competition. We have always had to compete with a whole variety of regional hubs, and there will continue to be new hubs that will emerge, and therefore it's critical that we work at a system level with all the partners, whether it's Changi Airport Group, airline partners, SATs, and other ground handlers, the unions, and certainly the government agencies, including CAAS. It's important that we mount a systemic response to preserve our competitiveness as an international aviation hub. Central to that, in terms of looking ahead, I think they will be underpinned by two key things. The first is to emerge from the COVID-19 pandemic in a manner that is safe and robust, so that travelers, airlines, and indeed the general population have the confidence that air travel can in fact continue in a safe manner, and that Changi is one of the places that they can travel through with utmost confidence. That is key. So that is what we are working towards. So throughout the last 12, 18 months, all the airport players in the aviation cluster have basically, it's been a Herculean effort, because we've had to invert the operating model in Changi. A civilian airport in general is designed for an experience, for passengers to interact, and we have had to reverse that logic and start to look at segmentation, testing, and all kinds of other necessary protocols to protect health, but it means the travel experience is diminished. But we are committed, as I said earlier, to reclaiming and rebuilding our status as an international aviation hub. And our VTLs helped us to raise volumes to about 15% or so of pre-COVID levels by the end of last year. And based on both global projections and our own anticipation, that we should be able to do better this year. But how much and how fast really is a function of the environment. And we need to always prioritize the public health assessment. I would add that beyond the safe recovery, the longer-term competitive proposition of Changi will also rest on sustainability. And that is something that CAAS is working with all the partners on, and that will also be an important competitive differentiator for us going forward. Your second point was on passenger volumes, and if we want to increase passenger volumes, what would it entail? Well, I think it is fair to say that the current protocols whilst necessary, they do impose a limit on how much we can grow within the current set of formulations. So we will have to work with our health authorities and the aviation partners to ascertain how much flexibility we have going forward and what are the possible rate limiting steps or aspects that we need to reconfigure so that we can go for the next bound of growth in terms of passenger volumes in Changi. And that is an effort that is currently being undertaken by MOT with CAAS and all our partners.
Dr. Tan Wu Meng.
I thank the Minister for his answer. I'd like to draw reference to a PQ I filed early last year in July 2021 about detection of COVID in the built environment, because better sensing of virus in the air and on surfaces may help us to find new vulnerabilities ahead of new clusters. I have a supplementary question for the Minister of Transport. The Minister has spoken about what has been done to clean the air better, air filtration, to try and sterilize surfaces better with UVC. But can I ask the Minister, how are we evaluating the effectiveness of these measures? Are we checking whether there's viral detectability in the ambient air? Are we checking for detectable virus on surfaces that members of the public or members of staff may come into contact with? And if I may put a second supplementary question to MOT, can the Minister confirm that there is ongoing attention to making sure that existing security protocols in the airport also interlink safely with safe management measures? So, for example, where staff are required to have their faces validated against photo ID, that this is done in a way that does not undermine the safe management processes against COVID. Thank you very much.
Mr. Speaker, if I may take the second question first, and thanking the member for raising these matters. Our highest priority is protecting the health and welfare of our frontline airport workers, because without them, the airport will not be able to function. So we have undertaken a whole series of steps to ensure that our workers are protected to the best of our ability. And that's why I mentioned specifically the moves we have made with respect to personal protective equipment, the PPEs, and we have heightened it. And now in almost all the settings, they wear N95 masks, for example, apart from the usual garb. I would add that we've also, the testing protocols that we've enhanced. All of these, on the one hand, they ensure a higher level of safety for our workers, but I must also emphasize that it also means additional inconveniences and challenges. So it's a constant recalibration, taking into account the risk, whilst we also focus on the welfare of the workers. So the short answer to the member's question is, of course, SMMs are our top priority, and when it comes to aspects like facial ID and so on, all the necessary protocols are put in place. And if there's evidence that we need to do more, we will do more. But I just wanted to highlight to members that every one of these moves, and I've been engaged in conversations with the union leaders and so on, and every one of these moves does impose a real human burden, which we have to take into account. On the first point on detection and how we continue to monitor, well, it's CAAS and Changi Airport are not the specialists in this area, but they're fully committed to protecting the environment to the best of their ability. In some ways, I think Changi Airport or its surrounding facilities are not too different to many commercial building settings and so on. There's flow of people from different sources, and there's all kinds of activities and convergence. So first, we will be informed by the general settings and requirements and make sure that these are observed rigorously. Second, we're also working with, as I said, the Ministry of Health, the National Environment Agency, and the Building Construction Authority. These are specialist agencies that have important perspectives that then informs the measures that we can take in Changi Airport as necessary. So let me assure members that it is something that we are watching and monitoring closely, and we will continue to take all necessary steps to protect the health and safety of our workers.